Fracture. Fracture happens when the bone cannot withstand the pressure or weight from their body or from an external force. Here are some examples of accidents leading to fracture. The most common fracture in sports is called stress fractures. Overuse of body can cause a bone breakage from a repetitive motion. As it tires your muscles, more force is excreted on the bone. Tripping, falling, or sliding can break bones in your feet, especially when a person lands their feet after jumping down from a slight height.
A bone can be classified into two. A broken bone that does not break your skin is called a closed fracture, but once it punctures the skin, it will be called as an open fracture. We can classify these two bone fractures with the following signs and symptoms.
If the patient is unconscious or in shock, which is because of internal or external bleeding, throbbing pain, pain that increases with activity and decreases with rest, swelling, bruising, tenderness, deformity, and difficulty in walking or bearing weight.
It is important to know what we should do if some accidents like this happen upon ourselves, our friends, or even our family members. Therefore, we can provide the help that the patient needed and prevent any further damage. On this part, we will teach you the first aid response that we must do if someone got a bone fractured.
First thing we should do is to immediately call to emergency medical services such as 911 before performing first aid to the injured. If it is an open fracture, cover the wound with a sterile dressing or a clean non-fluffy cloth. Apply pressure around the wound and not over the protruding bone to control any bleeding. Then secure the dressing with a bandage. Advise the casualty to keep still while you support the injured part to stop it from moving. Do this by holding the joint above and below the injured area. Place padding around the injury fore and make a sling for extra support.
For more specific context, we will show you how to make an arm sling to support an injury. First, ask the casualty to support their arm with the other hand. Gently slide the triangular bandage underneath the arm. The point of the triangle should be underneath the elbow of the injured arm. Bring the top end of the bandage around the back of the neck. The second step is fold the lower end of the bandage up over the forearm to meet the top of the bandage at the shoulder of the injured side. The third step is tie the two ends of the bandage together in a reef knot above their collarbone and tuck in the free ends. The fourth step is adjust the sling so that it supports their arm all the way to the end of their little finger. The fifth step is make sure that the edge of the bandage by the elbow is secured by twisting the fabric and tacking it in or using a safety pin to fasten. Do not move the casualty until the injured part is secured, unless they are in immediate danger. You can secure an upper limb fracture with a sling and a lower limb fracture with broad fold bandages. If necessary, treat for shock but do not raise an injured leg. Monitor their breathing and level of response while waiting for help to arrive.
Prevention is better than cure. We already know what we should do if some accidents like this occur, but it is better if nothing like this happened to us at all. That is why we need to know the ways on how we can prevent on getting our bone fractured.
Eat healthy. Keep your bones fit with a healthy diet. I'm sure when you think of a nutritious diet for bone health, the first thought that comes to mind is calcium. But calcium is actually not the only important nutrient needed for bone health. Vitamin D and vitamin K are important as well. Exercise. Exercising regularly will strengthen your muscles and improve balance, which will make you stronger and help you to avoid falls. Get the right shoes. Consider more than fashion when you choose your shoes. The wrong sort of footwear can raise your chance of having a fall. Look for low-heeled shoes that offer good support and have rubber soles rather than leather ones. While sneakers are fine, avoid ones with deep threads that can trip you up.
As we get older, our vision begins to fail us. This can lead to falls. Keep your home well lit so you can better see where you are going and decrease your chance of falling. Keep rooms clutter-free of things that you could easily trip over. Avoid slippery floors by putting down runners or carpeting. Install handrails where needed and avoid slips in the shower or bathtub with the rubber mat. If you have health conditions that require attention, make sure that you are taking care of yourself. Treating medical conditions keeps you strong and healthy so that you are in a good physical shape. Ignoring medical conditions makes you weak and therefore more susceptible to falls. Certain medications can increase your chances of falling due to side effects that will affect your balance. Talk to your doctor about any balance issues as well as your fears of falling and resulting bone fractures.
Accidents like this can happen anywhere and anytime. That is why we need to be prepared and have knowledge on dealing with this. I hope you learned a lot from us. Thank you for listening.